I used to sit in my house and not leave nights and nights in a row because I was afraid of what was going to happen. Am I going to lose control of my bladder in public? Am I going to, get sick because I ate the wrong food and have an episode? It's happened, in public. So sorry, it's a little emotional for me.
This is Good Outcomes with Dr. Dave. Welcome to our Patient Perspectives segment, where you'll hear firsthand from patients about their health journey to good outcomes. And I'm your host, Dr. Dave. Hello, and welcome again to another segment of Patient Perspectives. And today I have with me one of my favorite patients, actually, and not everyone gets to say that. And the main reason why is Jen Superdock here really stretched me at a time where I was learning and was one of the few people that responds so purely to counterstrain, and at the same time was kind of at that tip of my educational experience. And so you get to do two things: get amazing outcomes and give me a hard time at the same time. So Jen, thank you so much for being here.
Thank you for letting me be here and tell my story.
Yeah, you have an amazing story, and I want to just start off by giving you a moment to tell everyone about yourself, who you are, what you do, whatever it is that you want to let people know in terms of your situation and where you come from, and then we will get started with your medical history.
I have been here in Pensacola for about 25 years this year, actually, this summer. July will be 25 years. This is what I call home now. I was a little bit of a military brat growing up, so I've been all over to Germany and across the United States. But I'm from High Springs, Florida, which is right outside of Gainesville. I have a dog named Jax. He's my ride or die, would go anywhere together with me. He would be with me right now if he could.
No dogs on set.
Yeah. And that's a little bit about me. I work in the mortgage industry. I review title, enjoy what I do.
Awesome. So I understand that I got to meet you a little over 2 years ago, shortly after a pretty significant surgery. Why don't you tell us what you were dealing with up until the surgery, what the surgery was supposed to address, and then we'll go from there.
I started out about 13 years ago now, having symptoms of what everybody thought was GERD, just basic GERD. And then it developed into finally getting a diagnosis of gastroparesis, Barrett's esophagus, and GERD. And then probably about 5 years ago, I think now, maybe 6 years ago, I started having severe bladder pain. All of a sudden, loss of control of my bladder out of nowhere. And nobody could tell me why or what was going on and how it occurred and what was causing it. I went through physical therapy. I went through pelvic floor physical therapy. I went, through different kinds of medications, and then eventually having a procedure to put a medical device in to try to help communicate with the brain.
For those that don't know, GERD is just it's a term for acid reflux, and it's not just the burning in the esophagus or the throat. There's usually sometimes more than just that. And then gastroparesis is essentially the slow or lessening of the motility of the gut. So food does not necessarily move through the gut as well as it should.
Yeah.
So you had that, and then you were also losing control of your bladder. Which is, by the way, I commend you for even coming on the show and just talking about it. But even before we even talked about it, you're like, I just want to help people. I want people to know that there are answers.
Yeah.
And I know this is something that a lot of people struggle with, and it's usually on the down low. People are not necessarily proclaiming it, and it's usually a silent suffering type symptom.
I did for a while. I was one of those people for a little while that suffered in silence. I didn't leave my house for a long time in the beginning.
So you went to a couple specialists. No one had any answers.
No, possibly maybe some sort of autoimmune, but no real answers of why or how or what's causing it.
Got it. And so you tried traditional therapy, didn't work, and including pelvic floor. And then the only solution that you had found was the insertion of a medical device, which essentially is a bladder stimulator.
Yes.
This is essentially what it does. It helps the brain and the bladder communicate, and it seemed to have worked.
It helps, yes.
Okay. So tell me about after the surgery, how that went.
First surgery, we did a trial for about 2 weeks before we implanted the device underneath my skin. It is permanently inside, but we did a trial first and it worked. At least helped. 4 months later, we put the device in. It was a painful recovery, I'll be honest with you. I wasn't allowed to lift anything more than 20 pounds for 6 months to a year. I wasn't allowed to work out. I wasn't allowed to do hardly anything that I was used to being able to do. It was a struggle.
And I think that's part of your story, though, is what were you doing for physical exercise at the time?
I was lifting weights. I was playing all kinds of sports. I did roller derby. I did softball. I was in the gym all the time. So there was a bunch of different stuff before these medical issues started.
And so you got the device implanted, and it seemed to help. It helped with the control. Were you still having any incontinence episodes after it was implanted?
Yes, not as frequent or not as intense, but yes, they were still there. It took a while for the surgery and the healing of it and the brain communication, I guess, to kind of get on the same page,
Yeah.
for a lack of better words.
How long did that last?
So it was probably about the year mark, but then I had to have surgery again. We had to replace the battery because it had a malfunction.
So after that surgery, it was the aftermath of kind of once you got yourself regulated, kind of what brought you to me. Can you explain to me what those symptoms were and what you were dealing with after the surgery?
Yeah. After the surgery, I was having a lot of lower back pain. The device, it sits in my lower back, just above my buttocks. And I was having to make adjustments, whether it was the way I sat or, the way I just maneuvered throughout the day after the surgery for several months. So I believe part of it had to do with that adjustment and using my muscles maybe differently, but also the surgery, and that trauma to that area possibly causing pain, and it wasn't getting better. And my urologist, no fault to her, was just like, it takes time, but nobody wants to be in pain, right?
Yeah, absolutely. And so were you having bladder pain prior to the surgery?
Just imagine taking your bladder and giving it an Indian burn. And that's what the pain felt like.
That sounds terrible.
It was awful.
So did the surgery help with that?
It did.
Okay.
It did. It helped with that pain itself. I would still, for a little while, still get pain, but it wasn't as intense as that was. But I would still have the intense tightening of the bladder in the beginning.
So you were dealing with all these symptoms, and then you came to me upon a friend's recommendation. Ironically, for this bladder, these bladder issues and some of the gastroparesis, which is ironic because when I met your friend that referred you, I didn't have any of these skills available to me. And somehow she's like, go see Dave.
Yeah.
And so how was that first session for you? What was your impression?
I'm going to be honest, full transparency. I was very skeptical coming into it. But she, she's like, one visit and I was better. So I was like, okay, I'll give it a try. And so I came in, open-minded, but also skeptical because I had seen so many people and, come in saying, sorry, your labs are normal or I don't see anything wrong,
Yeah.
So that was my experience. So that's kind of where I came in.
By the way, this is my favorite evaluations when people come in so skeptical. And it's not because I get to, I told you so or anything. It's because the people who come in skeptical are the people who have been burned the worst by the medical society. Now look, what are you gonna do? It's not like anyone mistreated you or didn't hear you, which is they didn't necessarily have answers for you.
Yeah.
And then, by the way, even up to the point where you got to me, the surgery really helped. It was still a good thing for you to receive the surgery and the implantation. I mean, all of it was good. It wasn't complete. And even now, maybe we could argue that you're not fully complete, but maybe there are some things that we're fighting against, medically, in terms of the autoimmune and stuff like that. As a new grad PT or a young clinician, there are two things you need: mentorship and money. We will pay you a full salary to be mentored in our customized residency program right here. And it will actually help you fix those patients you know you could have helped more
and prepare you to launch your own business one day if that's something you want. Apply at our website and click join our team at www.renewintegrativept.com, and we look forward to hearing from you then.
My favorite type of client that comes in and is skeptical. And I remember not doing any counterstrain on you that first session. I adjusted your pelvis, did some soft tissue work and made your back feel a lot better.
Yeah.
And I think that's what sold you. You're like, okay, I'll come back. I think my favorite session with you was our second session together. That's when I kind of started doing a little bit more of my diagnostic process with counterstrain. And I'm curious to know your side of how that went for you and how you experienced that second session.
So the first session, I was like, okay, maybe this, something. So I come in for the second and I sit down and you start doing it and your thing. And I'm looking and I'm like, okay. And all of a sudden you like hit my eye and I feel a difference in relief down in my abdomen area around the bladder. And it's just like, it was shocking to feel that happen so soon, so suddenly. And how are you up here in my head area and something else, in my groin, abdomen is being relieved.
Yeah, and this was something that I didn't expect either. So we have a diagnostic process in counterstrain, and at that point, I knew that your problem was lower back and bladder and gastroparesis, the whole gut thing. And there are things that we can do to kind of see if we're going to help, sort of like what the physicians did with you. They kind of did a trial run and they saw like, well, let's see if this works. We're not going to implant anything. We're not going to do major surgery, but we're going to see if this works. And I did the same thing. And we call that touch inhibition. It's when we touch a part of your body that neurologically communicates to other parts of your body, and we can turn reflexes off. And so what's of particular note here is that when someone has pelvic floor problems, a lot of it's usually tone. And if you can turn a reflex off, the tone comes down and then there's relief, right? Yeah. And that's what we did. And then you mentioned your eyes. And this gets a little deeper into the counterstrain world, which it gets weird. It's not voodoo, it's neuroscience. It just so happens it's new enough where nobody knows about it. And that's part of the reason why we have this podcast, is to actually talk about these outcomes. The muscles of your eye communicate with the other muscle chains of your body. And there are certain ones that are actually intimately involved with your pelvic floor muscles. And so when there's inflammation and rigidity in your eye muscles, it actually impacts your pelvic floor. And so when I inhibited, you're like, what the heck? And I didn't necessarily expect it at the time. I understand. I'm a little more trained now. I get it. I'm like, okay, here we go. And I treated your eyes and we got a significant improvement with your pelvic floor pain.
Second visit was really what sold me.
And what's interesting is over the course of, I feel like it was like a month or two, we went through a process of identifying where you had trapped inflammation and eliminating it from your body. And it seemed like layer by layer, it all came off.
Yeah.
What was that experience like for you?
To be able to almost live a normal life again after getting through those layers was a game changer. I used to sit in my house and not leave nights in a row because I was afraid of what was going to happen. Am I going to lose control of my bladder in public? Am I going to, get sick because I ate the wrong food and have an episode? It's happened, in public. So sorry, it's a little emotional for me to be able to come in and see you for maybe an hour and a half a day, a couple times a week, to once a month, to now it's, once a quarter. To be able to do that and be able to go out and live a normal life almost again it's amazing.
Yeah.
Sorry.
It's okay. Yeah. It gets me a little emotional because we literally get to change lives. When I started this journey, it was really, really hard. Look, I got 4 kids. I got a wife at home. Like, I started a business and this was going to be an expensive, very expensive ordeal. And then on top of that, like the hours and hours of training and work, I was pretty good at what I did prior to counterstrain. I didn't need this, right? And to sit here across the table from you 2-3 years later here now, reliving this story makes everything worth it. And I appreciate it because there are clinicians out there right now that are debating whether they should do this.
Do it. You could help so many.
A shout out to the Jones Institute. They actually do the continuing education for this. And then obviously Brian Tuckey's the developer of fascial counterstrain. You'll get a clinician to take the first class or two and then not continue. And there are natural boundaries, just whether it's finances or just the availability. Clinicians have life to live. I mean, not everyone is cut from the same bolt of cloth. It's not necessary. Maybe it's not even relevant to their patient population that they feel called to. There are a lot of clinicians right now that are debating about whether to do this or not. And I get to sit across the table from you and many others and have this just recall the story of lives changed. I know that your bladder pain is pretty much all but gone.
Yep.
You don't have any more of that Indian burn of the bladder. I also recall your gastroparesis and your GERD is pretty much all but gone. There was something that you and I dealt with earlier on as well, which was this hemorrhoidal pain. I remember you'd walk in with like 8 out of 10 pain and you'd be kind of squirming a little bit. And we were able to pretty much all but eliminate that.
Yeah.
It seems as though all of these symptoms that are notorious for being very difficult to deal with and sometimes unavoidable and untreatable were treated.
Yeah. I canceled hemorrhoid surgery after a couple of treatments with you. Like I had it scheduled and we ended up not doing it because of the treatment that I got here.
I forgot.
Yeah.
That's so cool. I know that's a very painful surgery too. Here we are. We're on the back end of things. If you had to speak to the Jen, a couple of years ago before seeing Renew, it's easy to make this out to be like, oh, let's just toot the horn of Renew. Like, look, there are many clinicians out there that I believe are better than me that I've learned from. There are so many different people out there that need help that Renew can't help. This is all about, encouraging those that have diagnoses that maybe would give up. What would you say to someone who was in your shoes?
Definitely give it a try. You have nothing to lose by giving it a shot and seeing what it's out there and seeing what can help you. I have been to countless doctors, countless visits between you and Dr. Kelly. I have had the most amazing, life-changing experience between these two. Mm. I am almost living a normal life again. And it's just, it's amazing. 2 years ago, I thought my life was over.
Dr. Kelly is a naturopathic physician that actually helped me on my health journey. There was a part of my life that I thought my life was over. And she, in a lot of ways gave me my life back. And then she gave you your life back and gave me the opportunity to give you your life back. Like it's just like this circle of just wonderful training from her end, and then obviously the treatment that she provided. Tell me briefly like what you experienced with her and kind of like what that treatment looked like for you.
I started out with her shortly. I think it was maybe about 6 months into seeing you, and we started out going over every inch of my body, basically, of what the symptoms were, what I was having, what pain, were there rashes, were there this or that. She looked at the whole picture. And we started with different supplements. And in the beginning, we did start with some prescription medications, but she definitely wanted to get away from that. And we did. I was taking anywhere from, I think, 16 different things a day to now we're down to less than 5, I believe.
They're all like natural supplements. Yes. or something that's specifically trying to support your body.
Yes, and it definitely it's focused on my body as a whole. So when she's looking at my stomach, she's not just looking at that. She's looking at what is the cause of the stomach that also may relate to the cause of the bladder, and what are the headache? What is causing the headaches? What are these hormones? What are these? It's the whole full picture of what's happening with a female's body, because it's different than, even a male, or even different from someone who's 10 years younger than me.
Yeah.
So she's looking at that whole picture there.
Or someone with different genetics, like the reality. And you're a really good case study too, because we helped you tremendously, but I also saw some things in you that I was like, what, we need help, right? There are other things going on in your life that I'm like, I feel as though more of your symptoms are not just inflammatory. There's some other things that are driving some of this that you can be helped by a holistic approach from a medical side of things. And that's where Dr. Kelly came into play. And, earlier you mentioned like, give it a try. I think what you're referring to is 2 things. One is counterstrain.
Oh,
fascial
yes.
counterstrain, give it a whirl. You really have nothing to lose. You go in and we'll evaluate you, whether it's here or across the country. It is a technique that I so strongly believe in. I started this podcast. It literally, if there wasn't like counterstrain, I would not be on the screen right now. And then the second thing that I think you're referring to is giving it a try is a more of a naturopathic approach.
Yeah.
Holistic, integrative, functional medicine approach to health. And by the way, you've benefited from both sides. A traditional allopathic approach, surgery, medications did help you for a time. Who knows where you'd be without that surgery, by the way,
Yeah.
and so there's still benefits to it. And then on the other hand, you got as far as you could from an allopathic perspective, and then you were able to complete the process to the point where you're practically normal. And it's just a wonderful full circle story for you.
Yeah. It was key of finding doctors and medical providers that wanted to work together to see the whole picture.
Yeah, I think that's actually one of the problems of the medical world here is that we're so specialized. And because of the system, we're so busy that we don't actually get to sit down and talk to one another and communicate, because there are gut things that cause brain problems. There are heart problems that cause blood pressure problems, therefore pelvic floor problems, and everywhere in between. There are things in the feet that cause problems in the back and then the neck. And then it's like the podiatrist is not talking to the spine surgeon and so forth. And then just because something seems to be orthopedic, as you and I well know, it might just be a visceral or organ problem.
Yeah.
I know that we spend a lot of time treating your organs too.
Yeah.
And you're like, well, how does a physical therapist do that? It's like, well, fascial counterstrain gives us a neurologic model to interpret the body and then utilize the lymphatic system to get rid of the muscle guarding reflexes that cause musculoskeletal pain. Any final thoughts that you'd want to share with anybody moving forward from here?
Don't give up on your journey, even if it feels like it's defeating. Keep fighting for yourself. No one's going to fight as hard as you fight for yourself. If where you're at isn't working for you, don't be afraid to step outside the box and look for things that may work for you.
Be your best advocate.
Yes.
It is so true. Because unfortunately, no one, again, it's not a caring perspective. It's not like doctors don't care. It's not true. Most medical professionals go into those, they're just tied by the system. They're just overwhelmed and overworked, and they don't have enough time. But they do care. They're just not in a position to be your advocate. I love being like willing the world will step outside a normal bucket of treatment modalities.
Yeah.
Anyway, Jen, thank you so much for being here, sharing your story. I think you are going to inspire a lot of people and actually provide the encouragement necessary for people to step outside their normal box and go the abnormal way to their healing. Thanks everyone for joining us for another segment of Patient Perspectives. If good outcomes matter to you, subscribe and follow wherever you're tuning in. If you're a new grad or a young clinician and you're frustrated with the system and its outcomes, go to renewintegrativept.com, click Join Our Team to learn more about our residency program. And remember, healing is possible.